Hey everybody, this week we're going to talk about healthcare. Healthcare. The importance of healthcare cannot be overstated. And today I want to give you 3 reasons why the conservative approach is the right one when it comes to healthcare. And the reason I want to go about it this way, it's helpful to first understand the principles through which we approach problem solving. It's important that we frame the broader debate before we get into real detailed policy discussions. And that's what I want to talk to you about today, the broader debate. How do conservatives view healthcare? How does that differ from the left? And why does our approach make more sense? Well, here's why really quickly, and then we'll get into more detail. First, sustainability. Sustainability means fiscal sustainability, meaning can we afford it in the long run? It also means sustainability from an operational level, from a bureaucratic level. How complex is this system, and is it really manageable from a federal standpoint? The second thing is trust. Trust that the local level can find the solutions that are required for the people within a municipality or within the state. And also trust with doctors, trusting doctors to actually run healthcare and manage that doctor-patient relationship. Third, it's the way we view healthcare and not necessarily meaning coverage, meaning we view healthcare as access and outcomes, not just insurance coverage. So let's get into some detail here. Democrats and Republicans agree on the importance of healthcare, but the debate over how to achieve a better system has unfortunately devolved into these extreme and unrealistic policy proposals. The Democrats are increasingly pushing for single-payer or Medicare for all solutions. They claim that's the simplest and cheapest solution. But is it? First, this claim that it will be free or cheap is pretty misleading. A recent study estimated that it would cost $32 trillion over the course of 10 years. That requires massive tax increases on both the individual and the corporate level. And what do we get for this? Well, they would argue that the cost would be worth it because we'd finally remove insurance coverage from the equation. Well, that's not accurate. In practice, there's actually still a third payer. There's still an insurance company. It just happens to be a bureaucrat or the government. Because the entire population would have to be covered, this results in a severe rationing of care and much longer wait times. Additional regulations, even more than the hundreds of thousands that we see every single year through HHS, they would have to be written and rewritten to manage the care. These results have been well documented in countries like Canada, Great Britain, where a nationalized healthcare system exists, and it's only been getting worse there, so much so that they're actually looking to privatize a lot of their healthcare industry to increase the quality of care and to decrease wait times. Here's another important point. To justify this type of system, the left will claim that healthcare is a right. Now, that doesn't sound all so bad when you think about it. I mean, we would all like everyone to have access to healthcare. But this is carefully worded language because it implies that the government must then protect your right and provide accordingly. Now that's the problematic part. The founders knew this, all right? The founding fathers knew this, which is why they defined rights very carefully. The common thread between all of the unalienable rights in the Constitution, life, liberty, the pursuit of happiness, freedom of expression, freedom of religion, etc., these are rights that do not infringe on someone else. If we define healthcare as a right, we are effectively conscripting healthcare providers into our service through the force of government. That's an important point. What happens when doctors no longer want to practice or be in the system? Do we force them to go to medical school? And then once they graduate, do we force them to take a certain level of pay? Do we force them to be in this system that we've created for them? Where does it end? How does it get managed? How big of a bureaucracy do you need to enforce that? It's not just problematic, I mean, it's a real fatal flaw in this kind of reasoning. The idea that a government bureaucracy can effectively manage a system as complicated as American healthcare is fatally flawed. And it's hard to compare to a place like Great Britain and Canada, by the way, because, well, we're much larger, we're much more diverse, we have different preferences across huge swaths of territory. In addition to that, you cannot have a right to something that is finite or scarce. Healthcare is a limited commodity. Unlike your right to speak or pursue happiness, which you can do as much as you like as long as you're not infringing on somebody else's right. But you cannot have an unalienable right to a service that is administered by another person. That's an important point. So using language like healthcare is a right, which again, doesn't sound all that bad at first, it's meant to trap you into accepting a totalitarian control of the whole system. So this brings us then to the other side of the argument. Does that mean that a purely free market system is the answer? We got to think carefully about that also. So often we look at examples such as plastic surgery or LASIK for your eyes as cases where the free market has driven prices down. But we have to be careful there too, because those aren't great examples. They aren't really healthcare, they are more of a service. No one actually needs those procedures, they just want them. Actual healthcare markets are different from regular markets because of the human element. People need certain healthcare services, and our system, our society, doesn't deny care, period. In that sense, we already have universal healthcare, but the spreading of costs and the delivery of services are highly inefficient, being a mix of market forces and highly regulated government programs. In a purely free market, pure free market, we would run into problems with healthcare primarily because the poor and the very sick would be unable to afford insurance or be ineligible for insurance. There isn't a free market incentive that would fix that problem, so we do have what economists call a market failure. With other goods and services, luxury goods, cars, we can accept the idea that the poor simply can't afford as much as the wealthy. But with healthcare, we do have an interest as a society in finding ways for the poor and the elderly to access basic healthcare. Even if we didn't cover these individuals with programs such as Medicaid and Medicare, we would still not block a sick individual from the emergency room, so the cost is present whether we like it or not. Our current mixed system ends up being actually pretty good for the poor and the wealthiest, but terrible for the middle class. The middle class suffers because they aren't eligible for aid, like Medicaid, like the poor are, and they aren't wealthy enough to afford the best care. Increasing premiums and deductibles are rendering them functionally uninsured even though they have an insurance card in their wallet. So that's a problem. So this brings us back to the question, what is a reasonable debate to have with healthcare? If we understand that healthcare cannot be a purely free market, and we clearly see that a single payer system would be disastrous, then the right policy debate occurs somewhere in the middle. Right now we've got a system that is far too overburdened with regulation and severely hampers free market forces. Again, what is the one force in our society that is proven to drive prices down? It's the free market. So you have to have an enormous element of our healthcare market based in a free market system with competition. We need to move towards more freedom and choice, not towards more government intervention. Doctors are burning out due to excessive administrative burdens, and patients have their care managed by faceless insurers instead of a doctor they can trust. The ACA was a product of an ideological desire for the government to fix things with penetrating regulation as opposed to a sustainable systemic change, and a focus on coverage as opposed to quality health care and access. So again, the ACA, Obamacare, it goes back to a fundamental difference in how the left sees healthcare. They want to fix things with a group of experts, and they focus on coverage instead of actual care. Ideology does matter when it comes to how we approach healthcare, no matter what anybody tells you. It matters because we must explain why our approach to solving problems is more sustainable, both from an operational and bureaucratic level, meaning a more realistic understanding of what a government bureaucracy is capable of managing, and sustainable at a financial level, meaning can we afford this in the long term? The left will like to believe that they don't approach problems with an ideological framework. They say they are pragmatists, but in fact they do approach with an ideology. First, they believe that complex problems are solvable by small groups of experts. They believe this about most issues, and they certainly believe it about healthcare. On the right, we don't necessarily buy into this with most issues, especially healthcare. We believe the government's role is in ensuring that market incentives are aligned to achieve a desired outcome. In this case, the most cost-effective care for more people. We accept that there are vastly different circumstances and preferences across different regions, across the entire United States, and those all require different solutions. We do not believe that a group of experts in Washington can be so omniscient, so all-knowing, as to perfectly craft a one-size-fits-all solution for a large and diverse population. This brings me to the second point of ideological difference, which is local control. The left is ideologically opposed to local control and local responsibility, right? They would prefer more power in the hands of the federal government. We hear it all the time, actually, with respect to a variety of issues. They say, well, federalism is fine, but what if local elected officials or state governments aren't doing what we believe is the right thing to do? Well, this comes down to one thing, trust. Remember, that was the second point I made earlier, trust. The left does not believe in trusting the American people to elect local leaders. It does not trust them with more freedom. They do not trust doctors to manage a patient's care and therefore weigh them down with enormous administrative requirements. On the right, we understand that the only way to preserve liberty and establish a sustainable society where demographic and cultural differences can be vast is to trust the people to self-govern at a local level. We know they don't always do exactly what they should, but we believe in our system of democracy, and we believe in the power of the people to vote out leaders who are not performing well and not looking out for their interests. The difference in this ideology manifests itself, for instance, in how we prefer to manage Medicaid. The ACA, or Obamacare, was essentially a Medicaid expansion under the centralized authority of the federal government. The program is administered by states, albeit with significant federal oversight that limits flexibilities tailored to local needs. So, the left takes a problem, in this case, healthcare coverage for the poor, which we all agree we should have a safety net for. And then it provides a solution that is ideologically geared towards centralized control and distrust of local decision makers. The problem, of course, is that this is completely unsustainable on two fronts. One, the level of complexity required to manage 50 different states' needs and preferences. And two, it's unsustainable because of the endlessly rising costs that account for a massive portion of our debt. And by the way, we don't even vote on that every year like we should. This is why on the right, we prefer block grants for Medicaid. It allows states to administer Medicaid dollars the way they see fit. So take Harris County, for instance. In the Harris Health System, we use those dollars as reimbursement for healthcare services given to low-income populations from hospitals like LBJ. We use an 1115 waiver to pay for infrastructure, meaning facilities, doctors, instead of coverage. This means we focus on access, not coverage. What good is coverage if you have no place to go? Now, if Texas had a block grant on par with other states that are what other states are receiving for their Medicaid expansion, we could expand that access and do what works according to the unique needs of each county. Notice I said county, because even in the state of Texas, we have different needs from El Paso to Houston to Dallas. They're all different. Innovation in policy and government always happens at the local level. Doctors, hospitals are all yearning to innovate and figure out exactly how to deliver more and better care. We need to give them the flexibility to do so because we trust the American people. We know that those solutions will materialize if we allow them to. Many have already begun. So how do we get those solutions to materialize? I'll give you a couple examples of what I'm thinking. I'll tell you what, given the nature of our current politics, it doesn't seem likely that an entire massive repeal and replace bill will go through. I would support it, but it seems unlikely. The healthcare industry shows very little political appetite for massive change, even though they don't like what they see now, and they seem to prefer an incremental approach. Even your average voter is pretty reluctant to support changes that would affect their current coverage, even if they're unhappy with their plan. So, on our side, what we want to do is focusing on increasing access, maintaining quality, while also reducing costs. We have to focus on incremental changes that dismantle these enormous inefficiencies in the system, one bite at a time. This is what I'll end with. I'm going to end with what I want to focus on the most, and what I think shows a lot of promise, which is the direct primary care model. And how do we incentivize that to expand and increase? We have a massive problem in this country, and that's with preventive care. Meaning people don't go to the doctor early enough, they show up to the emergency room, they're already very, very sick. Primary care is the answer to this, and a relationship with your primary care doctor is of the utmost importance. Direct primary care is basically a model that is taking off across the US, where primary care doctors run their own practice, they have a membership fee, and this is cheap. We're talking $50 to $150 a month, and you get access to that doctor. Now, it's not insurance, you still have to buy insurance on top of that. But it does give you access, right? And they will list a certain number of healthcare provisions that are allowed within that membership fee. It's the first step into the healthcare system. That's your quarterback, your primary care doctor, to help you choose what insurance works for you, to help you choose what medications work best for you, to help you live a healthier lifestyle and prevent problems before they occur. How can we push for this? How can we incentivize it from a government level? Well, first of all, let's let our health savings accounts actually pay for that. Right now, it's illegal to. So that's the first step. Primary care is the gateway to the rest of care. And I think that's where we need to focus our efforts. That's where we need to start when it comes to fixing our extremely broken and expensive healthcare system. Thanks for listening. See you all next week.